Today we are going to talk about the 3-point suture. It is also called the corner stitch. It is a very common suture which is used to keep the tip of the triangular flap in position while preventing tip necrosis. It is commonly asked in the exam and surgeons frequently have to perform this while stitching at corner. We may face three kind of situation where we have to put this 3-point suture, but whatever the situation is, always remember that this mid-dermis is the area where the needle pierces the tip. So in first situation we assume that there is a triangular flap and which we have to stitch to the surrounding area. So here the mistake that we make is we start the suture here just beside the needle. So we go like this and this, then we put the stitches here, but it will make this tip tightly folded. So always try to avoid this. So what we do is, in this triangular flap we put stitches and we start our stitch a little bit further to the tip, just here, and our needle goes all the way through the dermis and exit here the mid dermis. Assume that it is triangular flap 1 and this is the surrounding tissue. Goes to the mid dermis, it exit the flap mid dermis of the flap 2 here, enter the mid dermis of the tip of the triangular flap, and it goes all the way to the tip and exit the mid dermis and enter the mid dermis of F2 flap 2, and the needle gets out here and we put the knot here. So this is one situation. Another situation is where two flap meets at the flap 3, that is F1, F2, F3. So in this situation we start our stitch here, the needle goes through the mid dermis, leave tissue 3 or flap 3, enter mid dermis of flap 1, then goes to this tip and it leaves the flap 1, then enter the flap 2, then same, it leaves the flap 2 and enters the flap 3, and ultimately it pierces the skin here and we put a knot here. So this is second scenario, and last but not the least, the third scenario is just like the first scenario. If this flap 2 is actually two flap, that is we get flap 1, flap 2, flap 3. So what we do in this scenario, it is just like the first scenario. We start the stitch just like first scenario, stitch here, and the needle goes through the dermis all the way and it leaves the flap 2, then enter the flap 1, leaves the flap 1, then enters the flap 3 and exit the skin here. Now we put a knot just between flap 2 and flap 3, and this is all about the 3-point suture.